If people have any doubts, the Delta variant of coronavirus is one of the most transmissible out there. Data from the CDC shed some new light about just how dangerous it happens to be. A document indicates it appears to cause more severe illness and spread as easily as chickenpox. It also indicates fully vaccinated people might spread the variant at the same rate as those who are unvaccinated. CDC Director Dr. Rochelle Walensky said, "I think people need to understand that we are not crying wolf here. This is serious." Joining me on the morning show once again, Dr. Jonathan Cantor, an epidemiologist with the Penn Center for Epidemiology. Good morning. So the CDC published data to back Walensky's controversial decision to have even vaccinated people wear masks. She said the measures this nation needs are extreme, and while getting the vaccinated or the unvaccinated vaccinated is still a priority, it is perhaps more important right now to rein this in. Is mask wearing the effective answer?
Well, mask wearing, we all know, from over a year of experience, is going to have a major potential effect. It will reduce the potential for vaccinated people to spread the virus, but it will also, of course, reduce the potential for unvaccinated people to prevent the virus. And the issue here, of course, is that we don't know who's vaccinated and unvaccinated when we walk down the street. And in the United States, we don't want to have a situation where we are requiring vaccine passports. We've made that quite clear on a political level. And so in order to really have an effective procedure, an effective way to make sure that the most people possible are avoiding transmission, that's one of the reasons they're pushing for universal mask wearing. And of course, that's coupled with this idea that people who are infected, ultimately, even if they've been vaccinated, do have the potential to spread the virus.
By the way, they're working on your audio issue back in the booth. Is it lost on a lot of people that vaccines prevent more than 90% of severe disease? Now, they're not 100% effective, but they are less effective at preventing infection and transmission.
Yeah, I think that's a critical point. And that is why, at every point, all of us kind of are re-emphasizing the importance of vaccination. We've been hearing a lot about the problems with vaccines. The reason we're hearing about the problems with vaccines, it's sort of like the reason we're hearing about, if the U.S. slips from being #1 in gold medals, it's because we're usually doing so well that it's a shock that we're not #1 in gold medals. It's the same idea here. The vaccines have a major impact, whether it's in terms of contracting the virus or whether it's in terms of getting severe disease. What we're looking at are breakthrough infections, which are not a common thing to happen, but when they do happen, that can be potentially concerning, and nothing's 100%. And that's why it's so important for as many of us as possible to get vaccinated to help reduce this community spread.
Let me ask you about that. Do you find that they really don't understand breakthrough infections or why they happen? After all, they say, hey, I got the shot, but with the shot, their chances of getting severely ill are statistically limited. It doesn't mean that they're not going to take a chance and perhaps develop some form of COVID.
Yeah, it's interesting. I think doctors kind of intuitively, and probably to our detriment in terms of public health communication, automatically are used to this idea of risk-benefit calculations with everything. So whether it's in terms of the early data where people were saying, hey, we're worried about the safety of the vaccine. Well, doctors, the natural knee-jerk reaction is, but we know the safety of the virus is bad. So obviously any vaccine is probably going to be better unless it really makes the virus worse. And now we're seeing the same issue crop up here, where I think we're used to this idea that if something is 95% effective, that means it's very good. It doesn't mean that you can go and do whatever the heck you want to do and not have any chance of contracting the virus. And I think that's critical to realize, is that the vaccine is going to reduce the chances of contracting the virus. It's going to drastically reduce your own chance of being hospitalized or dying from the virus, God forbid, but it is not going to prevent it 100%. And that's why those non-pharmaceutical interventions, things like mask wearing, are so helpful as an adjunct.
And thankfully, it seems people are starting to respond. And the medical experts I have talked with say, forget about flattening the curve in the immediate future. Things are going straight up. Optimistically, is this an issue we'll have to deal with until what? End of August, maybe mid-September?
Yeah, I think you're being very optimistic. I think if there's one thing we've learned from this pandemic, and this is even from the very early days, that anyone who tries to make any solid predictions, that you're going to get yourself into a lot of trouble. But I would certainly be surprised if we saw a sudden solution to this problem. The Delta variant is sort of like COVID, the original COVID, but much more transmissible. So that is a concerning situation, particularly because our vaccination numbers are not where they need to be. So I think, August, September, I think this fall could potentially become a challenge. And it's really going to depend in part on how we respond, whether it's with non-pharmaceutical interventions like mask wearing or whether it's with increasing vaccination rates. And that's where it's so important for all of us to step up and do the right thing for ourselves, our families, our community, our country, and really the world.
And whether or not things are exacerbated by the flu, which luckily wasn't a problem last year. Dr. Cantor, we'll talk again. Thank you.